You can rot in jail. Rot in jail. I will never stand for this shit. And I love it. Yes, man. My name is destroyed. Everyone, when they see Chico THWALA, they see a criminal, they see a drug lord, they see all this shit. I worked hard for my name. I can't stand this bullshit. Put a bullet on him. If he runs away, shoot him. Because he's under arrest at the moment. I'm his father. I can witness your shooting. The way he's running upon, I don't care. I'd rather bury you. You are better off dead than for you to destroy my name like this. Senzo Meyiwa, stealing from people, drugs and all that. I can't stand this shit. You must never get bail. Never. We'll oppose that bail vigorously. We now will oppose that bail. You must never get bail. You must go to jail. Bloody bastard. You were even wearing a EFF t-shirt when you were stealing. You want Julius Malema to actually harass you. Say Chico stand what and all this shit. EFF doesn't stand for that shit. EFF doesn't stand for people who steal. I so wish you could kill Senzo Meyiwa so that you can rot in jail. Rot in jail. I will never stand for this shit. And I love it.
28/10/2014, a body bearing the number 2076/2014 was pointed out and identified to me by Forensic Pathology Officer E. McQuena of the Germiston Mortuary.
We've requested that the photos of the post-mortem not be shown for the reasons that were canvassed when we were debating this disaster. Yes, on the screen. On the screen. Yes, but my colleagues have got copies of the post-mortem photos.
I conducted a post-mortem examination on the said body and recorded my findings on attached form G77/15, which facts I ascertained through an examination which required skill in biology, anatomy and pathology. To the Magistrate of Boksburg, I, Johannes STEENEKAMP, hereby certify that 1. I examined the body of an adult black male on 28/10/2014 at the Germiston Mortuary beginning at 8 o'clock. The death occurred as informed on 26/10/2014.
Yes, indeed.
The chief post-mortem findings in this case were attached schedule of observations. That is the schedule of observations. Under general, Roman 1, height 1,77 meter, mass 80 kilogram, which I estimated, physique average, nutrition normal.
My name is Senzo Meyiwa, Orlando Pirates goalkeeper, and I've been 10 years at Orlando Pirates.
So Mzansi, on Monday, 15th of April 2024, the defense will either talk about 375 as Ngomezulu, those were his last words between Ngomezulu and Baloyi, or we will have their own ballistic expert take the stand. So in today's video, let's go over what the pathologist said on the stand. So in today's video, let's talk about what the pathologist, Dr. STEENEKAMP, said, or should I say testified, on the stand with regards to Senzo Meyiwa's postmortem, which was done 2 days after he died. We will hear the gruesome details of how Senzo Meyiwa died, but most importantly, what I would like to highlight is, keep in mind, we still don't know, or should I say the court of public opinion wants one of the 7 people in the house to be pinned for the murder of Senzo Meyiwa. But let's talk about 2 individuals in the house, Kelly Khumalo and Zandi Khumalo. These 2 women are definitely much more smaller than Senzo Meyiwa was. Senzo Meyiwa was 1.77 meters tall. He also had an estimated weight of 80 kilograms. And not only that, he was fit, as you can tell from the clips I just played, as well as a healthy sportsman. Okay, he was the goalkeeper of goalkeepers at the time of his death, and he came with 10 years experience as an Orlando Pirates goalkeeper. Shout out to all Orlando Pirates fans. Leave a comment in the comment section so we can recognize you. But I digress. So I'm bringing this to your attention. Someone left a comment in my comment section of my last video saying, listen, Kelly Khumalo definitely did not kill Senzo Meyiwa because, hello, look how small she is. And if you listen to the description of the pathologist of how Senzo Meyiwa died, it does not make sense that Kelly Khumalo could possibly hold Senzo Meyiwa down, shoot him in a downward position. So the angle of the gun was in a downward position, and Senzo Meyiwa was pushing, the gun away, demonstrating a sense of there's some force going on. And definitely Senzo Meyiwa could have Kelly Khumalo with ease. So that rules out Kelly Khumalo and Zandile. There's the two friends, Umtoro and Utumelo. They're friends. Would the friends come with the gun to Kelly Khumalo's mother's house? I don't know. Let me know your thoughts on that. And then it leaves Longwe THWALA, Chico THWALA's son. Okay? I don't want to get too much into the Chico THWALA discussion, but the main reason I'm bringing this up and played the clips at the beginning, how tall is Longwe THWALA? What did he weigh at the time of him being at the Khumalo house? What was his weight? Could it have been a scuffle between Senzo Meyiwa and Longwe THWALA, while of course Zandi was hiding in the bathroom? I'm asking these questions and I'm carrying them forward from shout out to Inside Mzansi. They have a video. Guys, definitely go watch the video. I will also link it down below in the description box as well. Please subscribe to their channel because they're on their road to 1,000 subscribers. And if anybody knows anything about YouTube, 1,000 subscribers is the magic number. So please get this channel, Inside Mzansi. I don't know who they are, but they left a comment on my section. And as a YouTuber, I'm definitely going to support another YouTuber. So please make sure to go ahead and show them love and let them know you were sent to them by Mzansi Unfiltered. But I digress. Now, let's get back to the rest of the video and hear the testimony and sadly how Senzo Meyiwa died and try to piece together who really pulled the trigger.
Roman 2, special identifying features: an adult male wearing a blood-stained t-shirt, a blood-stained vest, blue tracksuit pants, and white and blue underpants.
Yes.
Bullet 1, the blue trousers are contained with blood-stained fluid. Stained with blood-stained fluid over the back. There is also a small 0.5 centimeter hole over the central aspect of the pants, just below the waistband. This does not correspond to any skin wound. Bullet 2, the underpants are blood-stained over the back. Bullet 3, the white blood-stained t-shirt shows a 4 centimeter by 3 centimeter star-shaped hole over the central anterior chest region. That's over the front of the chest. Yes. Corresponding to wound 2 in paragraph 4. It also shows a 1 centimeter hole over the back corresponding to wound 3. That's also in paragraph 4. The underlying vest, bullet 4, the underlying vest is blood-stained, showing a 3 centimeter by 2 centimeter rounded hole over the anterior chest region and a 1 centimeter defect over the posterior region. That's over the front and the back of the t-shirt.
Can you just explain the term defect? What does that mean?
It's a hole. It's basically a hole. External appearance of the body and condition of the limbs. And I describe these as there are ECG stickers, that's electrocardiograph stickers, situated over the left anterior and right anterior chest walls, so that's the front of the chest, over the left clavicle, that's the left collarbone, and over the right anterior shoulder line. That's the line extending from the shoulder downwards.
Sure. Makushisipham kanjalo ngibaleke mina ngiyongena ebathroom. Zukuzuke ngizwe ke mina ama gunshots amabili after lapho ngise bathroom ngipopole ngomnyango wase bathroom nakhona ngipopola ngileza phansi phansi. And then makusenjalo ngibone nangusenze gijima eyoyifihla phakathi kwe stand no sofa. Ngithi hayi bo ubalekelani manje because ngiyazibuza ukuthi hayibo kwenzakala. Makusenjalo ngibone nomana uyalandela na ukhela ulandela emva kwasenzo uyamemesa hayibo sizana umyeni wami hawu makusenjalo nangusenze qethu kebheka phezulu. And then ngibuza ukuthi hayibo iambulance athi ukheli ngeke iambulance izothatha isikhathi ngcono ngithathele umuntu wami ngizame ngokonke kusemandleni wami ukuthi ngihambise umuntu wami esibhedlela la ngempela singene sonke emotweni ngithatha ithawula lele beke ilanto sebembeke lona esifubeni la shayeke khona ngithatha ithawula leli ngilibeke ke nami ngiapply pressure lapho masihamba endleleni ngiyeza ukuthi umuntu hayi ufuna ukuvala amehlo ngiba sathi senzohlala hayi kube into ukuthi sengizwisisa manje ngibeke isandla eswini ngizwisisa ukuthi sesiyabanda hayi suke lapho yithi laba yasize sifike esibhedlela sifike sifune emergency, then from emergency bamthathe admit. And then besampopola kanjalo uma wamafika because besimshiye ngemuva yena. And then uma adlublundela iphambili abuza ukuthi bambeke ngaphi, and then ngisho ukuthi bambeke kuliphi ilantos, and then mayifika khona ngizongoma iqhuma ngesililo phezulu.
So ngale nkathi kwenzeka lesigameko
ngize ngambone sefika noma esibhedlela.
Now, you know, we have to be fair and give Zandi's testimony a chance. But when you put it side by side with what the pathologist said, then you're asking yourself, okay, so Dr. STEENEKAMP confirmed that there were ECG stickers on Senzo Meyiwa's body, which is in alignment with that. There was an attempt to resuscitate Senzo Meyiwa. So as Zandi has told us that, yes, they took him to the hospital, and then when they got to the hospital, they did try to resuscitate him, of course, with the help of their mother. I'm not sure what the mother's profession is, but the mother helped with that resuscitation attempt somehow. Okay, now let's tie this testimony back. So aligns with what the pathologist is saying was observed of Senzo Meyiwa's body, except the only part that doesn't make sense at the beginning is when she said Senzo Meyiwa ran. Okay, the 2 gunshots, she heard the 2 gunshots, and then Senzo Meyiwa ran. We will hear later where the pathologist, we heard here where the pathologist said the rupture on the t-shirt was 3 centimeters by 2 centimeters. I don't know how fit Senzo Meyiwa was, but he obviously must have been gushing a lot. There must have been a lot of blood gushing out of him. And for him to still be able to run, that is miraculous. And then live past that time and then make it to the hospital for a resuscitation attempt. But let's continue listening and let's put the pieces together.
This indicates that there had been some resuscitative measures performed with an electrocardiograph being performed to check the condition of the heart.
And Doctor, where would the electrocardiograph stickers normally be used? In which setting?
That is usually during resuscitation,
yes,
or for diagnostic procedure. And that is the important wound. And I described it as situated over the right anterior chest wall, that's the right front of the chest, 1 centimeter to the right of the midline and 135 centimeter above the heel, is a 3 centimeter by 1.5 centimeter oval-shaped lacerated wound. It's a torn, oval-shaped wound. And then there is a semicircular abrasion situated over the superior and inferior aspects, that's now the wound that I mentioned, measuring 0.3, the upper part, and 0.5 centimeters below the lower one.
Doctor, can you describe abrasion?
Abrasion is a damage to the superficial layer of the skin. In this case, I thought it was due to the muzzle of the firearm that had been used. The wound edges appear seared. That's a heat effect. That's burning. Okay, that's it. Situated just below the skin, blackened granular material consistent with gunshot residue are noted in the underlying soft tissue. So when I opened this wound and explored it, I noted this black granular material. And then in brackets, I came to a conclusion following the examination of this wound. I said this wound is consistent with a contact bullet entrance wound. And I say that due to the fact that when a muzzle is pressed against the skin, all the elements, that's the gas, the heat, the gunpowder, are driven into the skin. So with a muzzle firmly against the skin, especially the gas, will go below the skin and explode backwards towards the outside, resulting in this original big lacerated wound as I've described.
Doctor, when you say the gases explode backwards to the outside, what do you mean?
Away from the skin towards the muzzle or towards the firearm.
And the gunshot residue, what will that have resulted from?
That's from a firearm, the residue that was ignited. Then I've got a heading, wound track. The track of this wound passes downwards, backwards, from front to back, downwards, and laterally away from the midline of the body.
So if we can ask you just to demonstrate that.
Over the front of the chest, right, over the breastbone, 1 centimeter to the right of the midline, over the breastbone, around the level of rib 3.
Yes, and the wound passing downwards, backwards, and laterally. If you can maybe just demonstrate it just quickly.
It goes down. I think there is a photograph.
Yes, we will get to that. If you can maybe just quickly just show
on my body. Oh, okay. I've got my pen here indicating the firearm, and it would be roughly in a direction like this.
Yes.
From front to back, and away from the midline of the body.
Yes. From my understanding, what is the end up, as you say, it goes down?
The angle. It's an acute angle. It's an acute angle. Along the wound track. Then first bullet, it perforates the sternum on the right at the level of rib 3. The sternum is the breastbone at the level of rib 3.
And perforate, so can you just explain the term perforate?
It passes through. It makes a hole through it. Showing blackening of the outer aspect, and that's still consistent with the bullet contact wound, the gunshot residue. And then it also shows, as well as inverted bone fragments over the inner aspect of this bone. So little fragments of bone are driven inside the body, and this confirms a entrance wound. This perforation, or the perforation, measures 1 centimeter in diameter, enlarging towards the inner aspect of the sternum where inverted bone fragments are noted. And then the next bullet, it lacerates the pericardial sac, that's the heart sac, leaving a 2 by 1 centimeter irregular laceration.
Can you just simplify this? Yes, and what is an irregular laceration?
It
lacerates. Can you just simplify?
It tears.
Okay.
Laceration is a torn wound. Black granular material, as well as small fragments of bone, are noted surrounding this defect in the anterior mediastinum. The anterior mediastinum is the front part where the heart is located. One can see the heart sac just pushed up. It's not very clear on those photos.
And this finding in this bullet, is it indicative of anything?
The black granular material?
Yes.
It's indicative of a contact bullet wound. It's still the gunpowder that's driven into this wound. And then the next bullet, it lacerates the heart, resulting a 3 centimeter by 1 centimeter irregular laceration, that's a tear, extending from the anterior wall, that's the front wall of the right ventricle, that's the right chamber of the heart that pushes the blood towards the lungs.
Yes.
We're still with this wound, partially lacerating the right coronary artery. That's the artery that supplies the heart with muscles. You get 2, one on the left, one on the right, and this is the right coronary artery.
Yes, lobe.
And then it also perforates the lower lobe of the right lung, leaving a 5 centimeter by 3 centimeter irregular perforating hemorrhagic lacerated wound.
Just explain hemorrhaging in simple terms, doctor.
Now that's bleeding into the soft tissues of the lung. That's at the right of the back, inside of the chest, at the back, leaving a 2 centimeter by 1 centimeter hemorrhagic perforating lacerated wound. Continuing with the wound track, it is then joined to wound number 3, which is an external wound over the back. And I described this wound. And let me show you the picture. Would be, I think, 162, the best picture. And I described it as a 1,3 by 0,7 oval-shaped lacerated wound, again torn edges, situated over the right posterior chest. That's the back of the chest. Number 11.
Just before we proceed, doctor, the fact that the chest cavity contained 1,700 milliliters of blood, what is that indicative of?
That's blood loss, internal blood loss from the heart, as well as the lung in that area that resulted in this blood flowing into the chest cavity, resulting in the left lung collapsing.
Blood loss, what does that mean?
The person is bleeding into a body cavity, into the chest cavity. He's bleeding from a source, in this case the heart and the lung, and this blood is flowing into the chest cavity. When we say blood loss, that's technically speaking outside the body because it's not in the blood vessels where it should be. So although it's inside the body, it's not inside the blood vessels, and that is possibly the mechanism or how this person died.
Cause of death?
The cause of death consistent with bullet wound of the chest involving the heart and lung.
So according to the history, the deceased was shot at his home. Following this, he was taken to a hospital where he was certified as dead. Are you able to give an indication of, given the clinical picture that you've just outlined, how long the deceased would have survived after the infliction of the wound?
Well, the heart and the lungs are important organs, and injury, especially this type of injury to those organs, can cause a fatality. Sometimes it's instantaneously. In this case, I do not think so because of the mechanism of death, which I explained as possibly the blood loss. And I think in this case, and he's quite a fit young man, he probably would have survived seconds, minutes, definitely not hours.
And you mentioned during your findings that there was blood loss and the destruction of the heart.
Yes, blood loss, and there was an injury to the heart and the lung.
Yes. Of the sketch there, indicating the wound track, you earlier on, just scroll down. Yes, the wound track. You earlier commented that the wound is at an acute angle. What would you say the trajectory of the wound is?
It's down, back, and away from the midline.
Now, doctor, are you able to venture an opinion as to what the position of the deceased was at the time when the wound was inflicted?
My lord, when we do the autopsies, we usually describe the injuries as if the person is standing up, upwards, his hands next to his sides, palms facing forwards, the head looking straight ahead. They call it the so-called anatomical position. But in reality, we always know this is not so. People, when they are shot or assaulted, tend to move around or bend or do some movements. In this instance, I can, for instance, think, according to my autopsy findings, that if the weapon is held in a position like this, the deceased could have moved forwards, moving forwards and bending down at the waist, slightly bending down at the waist. If the accused was standing right in front of him. Or he could have tried to push the firearm away from his body, pulling it downwards in the downwards, backwards and lateral position.
Yes, Doctor, if you can have a look at photo 15 of Exhibit D, photo 15? 15. Yes, photo 15. Now, the evidence is that there was a struggle between the deceased and other occupants of the house and the attackers there in the kitchen. What would your comment be regarding the post-mortem findings?
Well, basically nothing, unless I take into consideration some of the notes and things that I see on the wooden door, which looks like a 2.
Yes, do you want to elaborate or do you want to stand by that comment?
No, the deceased could have stood anywhere unless I know where the bullet went. The bullet passed through the person, so if it was shot from the door side, the bullet would have gone the other way. If it was shot standing against the door, it would obviously have gone through the door.
Now, Doctor, are you able to state as to how long it took for the bullet to perforate the, as you stated in your findings, to perforate the body of the deceased?
We're talking about seconds, milliseconds perhaps. I'm sure a ballistic officer can give you more detail on the speed of the firearm. I'm specifically referring to the bullet entering and passing through the body.
During that process, would the deceased have started bleeding when the bullet entered and left the body, as you've just described?
He would have started bleeding immediately. Once it injured the heart and the lung and the small artery, he would have started bleeding immediately. As long as his heart was pumping, he was bleeding out away from the heart into the chest cavity. If the mechanism of death was, as I suspect, that there was blood loss, he died of blood loss, the blood would have circulated from the left side of the heart, which was still pumping, down through the body, up onto the right side of the heart, and he would be bleeding from the right side of the heart. It would be landing into the chest cavity. Some blood can still leak out through the skin wounds, not be like spouting like an arterial blood, for instance.
What would be the position to say the blood will not be spouting out?
Squirting out, for instance.
And just lastly, Doctor, you mentioned that you have taken a second for the bullet to enter and leave the body. When the deceased started bleeding internally, would the bullet still be in the body, or what would be the position? Milliseconds. As a please, yes.
Am I correct? Yes. No, milliseconds to seconds, yeah.
Yes. What would be the position regarding the bullet when the deceased started bleeding internally?
Then the bullet must have left the body already. The setting is the abdomen, that's the stomach. 16, the peritoneal cavity, that's the cavity in which all the organs are housed in the stomach, was normal. Then 17, the stomach and contents. The stomach contains 500 milliliter of partially digested food material in which rice, vegetable matter, and fragments of meat can still be identified.
If you've made it this far in our video, oh wow, that was a lot of biology, but there's a very, very descriptive sense of how Senzo Meyiwa died. May his soul rest in peace. And one of the detailed description is that there was immediate blood flow into his lungs and he had a lot of internal bleeding. There was over 1.7 liters of blood in his body cavity, in his chest cavity. So what this goes on to show is that was he going to be able to have run, as Zandi described in her witness testimony, as someone who was there in the house at the time of the shooting? What are your thoughts on that, Mzansi? But, as I was listening on to this biological description, from the pathologist, almost said the pathological liar, but no, from the pathologist. So it made me think of Keenan Forbes, aka, and how he died instantly. So if you remember the Nkabi snuck up from the back, pointed the weapon directly at his head, the back of his head, one shot, and immediately he dropped to the ground, and then there was a pool of blood around him. Unfortunately, I'm not able to show that. YouTube will never allow such a descriptive video on this red app, but that yeah, just remembering that video made me realize that, yeah, since there was no resuscitating him, there was no let's carry him to the car. This guy is bleeding profusely, and he survived just, if at all anything, seconds to a few minutes per the pathologist. So ayikho le nto kaZandi where we carried him, took him to the hospital, resuscitated him, and then he died. No, there was a lot of blood. And I think what they were trying to do, and this is alleged, was clean up that entire mess. This is devastating. Even to just hear it again, it's devastating. And you know, the more you listen to something, the different angles that you get to hear. But that's it from us today. If you've made it this far, you know what it is. You're part of our VIP gang. Thank you so much for watching our entire video. Make sure you drop an emoji in the comment section so we know who you are. Make sure as well that you drop this video a like this video. It is absolutely free to like a video. It is also free to subscribe to the channel. So please leave this channel by doing that. And remember, go into the description box. I'm going to add the link to Inside Mzansi YouTube channel so you can watch their video on this concept as well. Thank you so much for watching, and catch you, of course, on our next upload. Yes, thank you so much.